Hello, Dr. James Bogash, expert in health and longevity, and as a practicing chiropractor who believes very heavily that soft tissue techniques, so addressing the muscles, the ligaments, the tendons, the fascia, different soft tissue techniques, stretching, is absolutely critical when combined with things like manipulation or exercises to get the best outcomes, specifically for pretty much anything, but in this particular video with low back pain. Before I go into the details of these three studies I'm going to present, make sure you like this video, share it with somebody you think needs information, and subscribe to the channel. So that being said, I clearly have a bias, but after 28 years of practice, starting out of the gate, understanding how important the soft tissues are, it's been frustrating for me how much a lot of my profession does not. They just adjust. Maybe somebody else does massage, somebody else does rehab, but the chiropractor is not doing the hands-on soft tissue. And I think not only the knowledge of having the practitioner doing the soft tissue work, but the proximity. So you're doing the soft tissue work, you're doing the adjusting, you're going to get the best outcomes. I've seen that in my practice, and clearly it's a bias, but it's a bias that's been backed up by like countless experiences. Somebody goes to another patient goes to another chiropractor, sees them for 20 visits for something that is literally fixed in one. And that's the difference when you start adding different soft tissue techniques. So there's 3 studies. I'm gonna put links for all of these, and they are all highlight how important it is to address the soft tissue. So the first one was a study in 45 patients. They used massage versus physical therapy, rehab type techniques for people with chronic non-specific low back pain, which is most cases of them. And multiple outcomes were better when the massage therapy was added in to the physical therapy, rehab type exercises. There was another study, 64 patients with myofascial release, which is a little bit more specific than what you generally do with massage, and they added it with and without or core exercises, so building your core with and without myofascial release. And again, the myofascial release combined with the exercises outperformed just doing the exercises alone. The other study was on 36 people. It was looking at sacroiliac SI joint, the very bottom part of the spine, SI dysfunction, where they did mobilization only or did mobilization with piriformis stretching, and which to me just seems like we absolutely need to address that. But they found that the piriformis stretching with the mobilization outperformed. Again, I clearly have a bias, but if you're going to really look for the best outcomes, you have to find somebody that is competent in treating the soft tissues. It's not about going to a provider, and maybe there's a massage therapist there. Not that they're not phenomenal, but there's a different approach when you understand and look at things like instrument assisted, whether it's Graston or anything like that, fascia manipulation, maybe dry needling. Ask me in a decade, I'm still a little bit skeptical about it. But the idea of combining soft tissue, or in my case with manipulation, is going to give you the best outcomes. And these 3 studies all show that adding certain aspects of soft tissue provide better outcomes. So if somebody you're seeing is just doing exercises and they're just watching you from across the office and not actually doing hands-on, or maybe you're seeing a chiropractor and they've just adjusted you 3 times a week for the last, 72 weeks, and you're not getting better, maybe it's time to really don't throw the baby out with the bathwater and say, hey, PT didn't work, or chiropractic didn't work. You need to find somebody that addresses the soft tissues as well for the best outcomes. As always, I'll post a link to these particular studies in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.